So various strategies have been utilized to improve ocular drug delivery. And one of the strategies include improving precorneal residence times. And this can be achieved by using a viscous semi-solid preparations such as gels or ointments. These semi-solid formulations can help to improve ocular bioavailability and sustain the drug release. However, this strategy are known to cause ocular adverse effects such as irritations, redness in eyes, blurred visions, and blinking reflex due to the discomfort. Because if you realize, instead of when you put eye drops and you put the gelation, especially when it comes to when you have bacterial infections on your eye, the doctor will prescribe you with the gel-based topical eye drops, and sometimes it can be uncomfortable. So this is one of the disadvantages of having this gel or ointment preparations. So some example of device used to increase residence times includes inserts, which is the drug impregnated device, and then this device will be included inside the eyes. And then we can have a collagen shield. It looks like a lens, and the drugs can be dispersed when the layer of collagen is gradually degrading. So it's made of polymer, and the drug will be emulsified or mixture along the polymers that make the collagen shields, and the drug will be slowly released when the collagen is degrading. And we can also have the ophthalmic rods, where the rod, the end of the rods, is coated with therapeutic drugs, and you can just put straight away the ophthalmic rods to the eyes, and the drugs layer that coat can be dissolved with the tear films and just release the drugs to the targeted area in the eyes. So next is on how we can reduce the precorneal clearance. So one of the strategy is to utilize the in situ gelling systems. In situ hydrogels refers to the polymeric solution which undergoes solution to gel phase transition to form viscoelectric gel in response to environmental stimuli. So the advantages includes minimize the blinkings, and also it is proven to increase the precorneal resistance, thus prolong the contact time of drug with cornea, and also enhance ocular bioavailability over the standard or conventional aqueous drops. And the gelation can be elicited by changes in temperature, pH, and ions, or can also be induced by UV radiation. Some strategies have also introduced mucoadhesive polymers such as chitosan and methylcellulose for emulsion coating. So the advantage of mucoadhesive is have a greater interaction with mucous layer or the eye tissue. So basically it has been shown that chitosan surface coating improve precorneal residence times of the drugs or the API, which is the active pharmaceutical ingredients, thus improve the ocular bioavailability. Next, once we have improved the precorneal barriers, next thing that we want to achieve if we want to improve the ocular permeability means that when you have a formulation to enhance the residence times in the cornea, next is how we can further permeate or penetrate into the cornea, and this can be achieved by the chemical modification of the drug structure, or we can modify the physical chemical properties of the drugs, or we can use additive or external agents to modulate the epithelial membrane. So you remember the cornea, they have this, they like sandwich membranes with all this tight junction. So this is something that we want to permeate for the ocular drug delivery. Okay. So one of the approach is to use a prodrugs, which is to have a bioreversible derivative of existing drugs, which is further modified to alter its absorptions, to decrease the side effects, or to prolong the duration of action. Or we can also introduce lipophilic functional groups on the drugs, because we know that the drugs need to have lipophilic in order to pass through the sandwich-like layers of the epithelium of the cornea. Remember from the early slides that we had earlier? But bear in mind that not all drugs possess suitable functional groups that are readily available for chemically modification. So that's why sometimes, depending on type of the drugs, we still need to have delivery systems in order to facilitate the delivery of the drug to penetrate the cornea. The next is we can have a various additive can also be added to the topical eye drops, such as permeation enhancer. So basically, the permeation enhancer work by modifying the corneal integrity in order for them to facilitate the delivery of the drugs into the cornea. Other additives such as gelatin agents, surface active agents, and bile salts were also studied as a possible permeation enhancer. Permeation into cornea can also be achieved by modulation of ion transport process, which is, for example, we know that cells are equipped with carrier proteins to transport essential nutrients like the glucose and amino acids. So, by utilizing the prodrug strategy, the drugs that we wish to deliver across the cornea can also be covalently linked or chemically modified with amino acid, for example, so that this amino acid can be recognized by the transport protein and thus can help to transverse it to the cornea. And calcium chelating agents are often included in topical ocular drug formulations. Example of the chelating agent, the common one is EDTA. So if tight junction membrane integrity is disrupted or the extracellular calcium ions are removed by EDTA, drug permeability increase throughout the tight junctions. So will help to opening the pathway to deliver drug across the epithelium. And next, this molecule specifically 2,5-diterbutyl, basically it's a benzohydroquinone, is actually a calcium ion pump inhibitor. Thus, when you use this reagent as an additive, its presence will deprive the extracellular matrix from calcium ions. Thus, it will cause the elevation of the intracellular calcium, which lead to opening of tight junction. When there is an imbalanced concentration of calcium between the extra and intracellular, it will lead to the opening of tight junction. And as a result, it will increase the paracellular permeability through the epithelium.